Hi everybody, I am Dr. Saheer Sainalabdeen, working as specialist pulmonologist at International Modern Hospital, Dubai. Today I will be talking about asthma. As you all know, asthma is a common disease which affects millions of people in the world. By definition, asthma is defined as a chronic disease which affects the airways, causing it to inflame. That means swelling of the airways. Along with that, there is increased response of the airways to various triggers, otherwise called as allergens. So if you say about UAE, how common it is, one in every each 8 adults is affecting, and if you say for the children population, it is affecting almost 13% of the child population, and almost 50% of these childs were unable to go to school because of this asthma. So how it usually presents, or the patient, how the usual symptoms are. If you see, most of the symptoms patients present with cough. See, then the cough is especially during the night time, and it's like a dry cough. Patients say that they are unable to bring out sputum, and the other presentations are when the patient breathes, they have a wheezing sound. Along with that, they say chest discomfort, and when it becomes severe, the patient can't walk much distances. These are the common presentations of asthma. And so now I will be telling about the risk factors for asthma. So the most common cause nowadays we find it is smoking. As you all know, smoking is not good for anybody. So especially if a person who is asthmatic, if he smokes, there's high chance that his asthma can trigger. The other risk factors include outdoor pollution. Outdoor pollution means the pollutants coming from the vehicles, from the factories. Along with that, if you say about UAE, whenever there is climate changes, there is a lot of sandstorms which can trigger asthma for a lot of patients. If you come to indoor means house, what all can be the triggers. The common causes are the allergens released by the cockroaches, use of more carpets at the house leading on to a lot of house dust mites, and a lot of people have pets at their home, including cats, dogs. So the fur is allergen to lot of people. And other common risk factors are exercise for some kids. If they play for a long time, they'll feel breathless. And some patients, they say if they eat a lot of food like crabs or nuts, they feel their asthma is increased. And some patients, after a viral infection, they say their cold is leading on to severe cough, and this cough lasting for a long time and is associated with wheezing. So these are the common risk factors for asthma. So coming on to the management, how will you treat asthma? The first thing is to make a proper diagnosis of asthma. So we should be sure that the patient has asthma only. So that we can tell about by the history of the patient, whether any of his family members have asthma, or whether he has symptoms from the childhood. And when the doctor examines him, he can have a lot of clinical examination findings which can tell us whether the patient has asthma. Then, the other thing is, how will you diagnose asthma? The current guideline says that the asthma should be diagnosed by objectively also. So the common test which you do is called a spirometry. In we assess the patient lung function, and the spirometry can tell us whether the patient airway shows any features of obstruction is there or not. If the spirometry clinical findings and the patient history correlates with asthma, then we have to start medicines for him. The medications of asthma can be broadly divided into two. One is called as relievers. Relievers means when we give that medicine to somebody, it will decrease the symptoms like cough, breathing difficulty, wheezing, but it won't treat the underlying cause, what we call as inflammation of the airways. For that, we have to give patients other medication which is called as preventers. So these medications usually the medication which we give is called as inhaled corticosteroids. If we give this medicine to the patient, his inflammation will come down. The main thing of this medicine is the patient has to take this medicine regularly as prescribed by the doctor for the duration as told by him. It may vary from 3 to 6 months or 1 to 2 years. Some patients it may go up to 2 to 3 years. By this we can almost treat asthma very good. So if somebody asks you whether asthma can be cured, if we tell him frankly, it's difficult to say we can cure, but we can treat patients such a way that he can live a healthy life, he can do all the routine activities. So asthma is a curable disease, nothing to be worried of. You should take treatment at the proper time. You should avoid the risk factors which increases asthma, like if the climate is changing, better to avoid outdoor activities. If the climate is very humid, better to avoid. If there is news that there is a sandstorm, better to avoid. If you can't avoid, use a mask so that you don't get all the allergens into the body. And whenever you feel that you are symptomatic, better to go to a pulmonologist or a chest specialist for the further treatment. So I hope this talk will be very useful to you, and if any queries, you can contact me in my hospital. Thank you.